Good afternoon. So we're going to do an update on the Montreal situation. As we all know, Montreal is still in the red zone. Red zone that I was saying that I was qualifying as uncomfortable last week, and I think it is still this way. And we're seeing at the end of this plateau a little increase in the number of cases. It's not an increase that is exponential, but we still see a higher number each day. Last week we had an average of 250 cases each day, and this week it's more around 280 cases. Our reproductive rate has increased above 1, saying that we have more contacts, something that we want to lower under 1. And we've also seen a shift in the proportion of cases in our elder population. When we were in the plateau, they represent the 65 years old and older represented 8% of our cases, and now it's more than 14%. So we're seeing this shift. Saying that the virus is attaining our elder population, the most vulnerable for severe forms. When we look at the positivity rates, it's quite stable, around 5%, the average for the region. But we also see specific boroughs or neighborhoods with higher prevalence, higher positivity rates. We still have Parc Extension that has the highest one with 11%. And we are seeing emerging new neighborhoods like La Salle, La Chine, and Rivière-des-Prairies that that have doubled their positivity rates in the last week. So we encourage the population in those boroughs, if you have symptoms, if you have been in contact with a case, or have been in a place or where there is an outbreak, do not hesitate to get a screening test. It is free, and we're making it more accessible in those neighborhoods. When we look at the outbreaks, we currently have, when we look at the active outbreaks, those in which we have seen cases in the last 14 days, we have 247 active outbreaks, but most of them, 60% of them, are small. It means less than 5 cases and are well controlled. We have 112 in schools, 36 in daycare centers, 53 in workplaces, 34 in healthcare units, and 12 in the community. And where we are, as I was saying, with the shift we're seeing in the elder population, where we are more preoccupied, is the increase in the number of cases and outbreaks in CHSLD and elder residence, private elder residency, where we are working really intensively to make sure that we stop rapidly the transmission. A new approach that we're adding this week in our intervention is what we call the backward tracing intervention. The research has shown us that about 10 to 20% of cases are responsible of more than 80% of the transmission of the virus. And this transmission is linked to events that we call super spreader. And those events have specific characteristic, where in English we call it the 3 C's, crowded places, close contact setting, where people are singing, yelling, or with heavy breathing, and enclosed spaces with poor ventilation. So we're going to have some questions, the people that are going to be tested or when we do our investigation, to rapidly identify those events and try to retrace contacts that were at those events, but backward, not only contacts that the cases had. So it's a new approach that we will evaluate, but we see that we are inspired that with practice that we have seen in Asia and more specifically in Japan. Lastly, I just want to say that we look at the control of the pandemic and of the virus, but at the same time, we are preoccupied with the collateral impact of this pandemic, and we are now launching a festival on the consumption of drug, alcohol, and tobacco. And what we're seeing is an increase of consumption due to the pandemic. Some groups have decreased, mostly elders, but what we see in the young population is that we have a significant increase. For alcohol, we have a third of the population saying that they have increased their consumption, mainly 18 to 34 years old. It's more than 41%. And it also has the people that consume each day have also almost double. The percentage has almost doubled. We see the same thing for tobacco and for the consumption of cannabis in the population. So we know that the pandemic is a stressful event for a lot of people, and consuming those substances is a way for some people to control their stress. But at the same time, I think we all have to be vigilant about ourselves, but people around us, and do not hesitate to consult or to find other ways to other strategies to manage the stress or loneliness that we have. So, services are available in the CLSC and CIUS, so we really encourage population to not hesitate in consulting for those kind of problems. Thank you.
Good afternoon, Dr. Drouin.